Today on Triad Perspectives here at North Carolina A&T State University, we'll be talking about Alzheimer's, how it affects your life and lives of people around you. We'll be talking to a professor from A&T and someone from the community. Hello and welcome to Triad Perspectives. This is produced by the television station at North Carolina Agricultural and Technical State University. We're excited about this show because each week we have an opportunity to talk about things that are happening right here on our campus and things that are happening in the community all around us. And sometimes the way those things sort of come together. First of all, today we're going to be talking about Alzheimer's and research that's being done here at North Carolina A&T, and I'll introduce you to my first guest. Her name is Dr. Sharon Cook, and she is the director of the Center for Outreach in the Alzheimer's Aging and Community Health Program. And welcome, Dr. Cook. Good to see you. And I think you call it COAACH.
We do. We call it COAACH for short.
Spell it. It's
COAACH, and the two A's are Alzheimer's and aging. So normally people get that confused, but we call it COAACH.
I know when I called the office and I said that, someone said, "Hello, Coach." And I thought, no, I'm not calling the athletic department.
No, you had the right place.
I had the right place. I'm glad to have you with us today because obviously A&T has taken a big step into the area of Alzheimer's research. Tell us about that.
Right, we have. We see ourselves as leading the nation. We've got the largest genome-wide African Americans genetic study in the country. So we're extremely proud of that. And then here at North Carolina A&T, we have the only outreach center of any HBCU in the country that's attempting to reach out to the community and bridge the gap between kind of what we call bench science, which is the research that goes on, and the really technical biomedical part of Alzheimer's, and then what we need to inform the community about so that we are equipped, prepared, and that people at least have an understanding of what they might be experiencing themselves or plan to experience with family members.
Now, you said for African Americans. Are you strictly working with African Americans?
No, we're not. No, we attempt to be inclusive. We certainly would like to reach out more to the Latino and Native American population, but our initial research was looking at engaging African Americans in the genetic study because such a small number of African Americans have been entered into clinical trials nationally. So there are national mandates to increase those numbers because in particular we have not been engaged in those types of studies.
So are African Americans more likely to get Alzheimer's than maybe some other races?
We are 2 to 3 times more likely to have Alzheimer's disease, and so those things, of course, are of interest to us at North Carolina A&T, being a land-grant institution with a mission to give back and to serve.
Is it hereditary?
That's a real complicated answer. It is not directly linked, but there are genetic factors that contribute. So it's like most things that scientists and researchers talk about. There's a yes and a no. So that the short of it is, if there is a situation of what we call early onset Alzheimer's, which is also referred to as familial Alzheimer's, if one of the parents has a gene that's called the APOE4, an individual is 4 times more likely to be diagnosed with Alzheimer's. If both parents have that gene, they're 10 times more likely, but there is not always the direct correlation with it because there are other environmental and lifestyle factors, and we may get into that later, but certainly things around hypertension, cardiovascular disease, depression, all those contribute in really interesting ways. And so as a social scientist, it's really interesting to look at it because African Americans may be impacted by stress, poverty, and some of those other external environmental factors more than other groups, and that may explain some of the contributing factors around our prevalence of Alzheimer's.
Now, the things you just mentioned are things that African Americans and other races too have dealt with from the onset.
That's right.
You know, poverty, stress, lack of income, jobs, all of those things. So is it, I don't know how to say it, is it getting better with African Americans? I mean, because our lifestyles have changed, I would say, a good bit since, let's say, 50 years ago.
Right. And again, you're asking very great questions, but these are difficult questions. So let me see.
I'm sorry.
No, I love the difficult questions. It is getting better in that we have more information to inform us around how we might take care of ourselves, make better health decisions. But what we're seeing is that with Alzheimer's, we know, just in short, in layman's terms, there's some protein deposits. There are these amyloid proteins and tau proteins that start to develop in the brain that basically don't allow signals to kind of complete themselves, as if we were thinking about shooting a ping pong ball or shooting something across. There's an interference with that. And so that starts then to kill the brain cells, and we start to see all kinds of problems with memory, cognition, judgment, motor skills. But we also see correlated with that interesting disorders that, as you allude to, have been around. We almost see now close to a 90% correlation with diabetes. So at the COAACH Center right now, we have an ongoing diabetes project, and we're interested in expanding that because diabetes disproportionately impacts African Americans also. So we have issues with sight, we have issues with amputations that are disproportionate. So there are a number of factors that are coming together in not so clear ways that we can always draw a line to correlate what's happening, but we're seeing those, and we're just really excited to be on the forefront of that and have North Carolina A&T involved, not only in the medical research, but doing community-based research and getting organizations involved.
So who decided to do this?
Dr. Goldie Bird, and you're familiar with that with that name. Almost everyone on campus knows her. And as a geneticist, I believe she became involved in this about 10 years ago. Was interested not only in recruiting more African Americans for the clinical trials, but in answering that question that you have: is there a genetic link that we might be predisposed to? And again, we call that gene the APOE4, but we still know that I may have that APOE4 and not have the symptoms at 65 or 75 that another individual has. So at another level, you could almost think of it as we may carry these gene traits and be at risk, but there are other factors that trigger or maybe flip the switch and we see these things moving. And that's where we become less and less clear about the genetic predisposition. Again, we think about genetics really being linked. If I were 40 or 50 and started to have a diagnosis, then I certainly might want to get my child or children. They may want to be tested. We may want to look at it then because of early onset. But age is the #1 risk factor. So as you know, we're living longer. So if there's something that we think is being triggered around 75 to 85 within that 10-year span, as we have, as you say, as our lifestyle starts to increase, we live longer, we have more opportunities, we are probably going to see more and more movement in that direction. But we are hopeful.
Can you cure Alzheimer's?
You cannot. In the top 10 causes of death, Alzheimer's disease is the only one that cannot be prevented, slowed, or cured. And right now it is the 6th leading cause of death in the U.S. And we're looking at about 5.4 million Americans being diagnosed right now with Alzheimer's disease.
That's a lot.
That's a lot.
That's a lot. So that means the communities, A&T, the outside city communities, everyone's going to be on top of it.
Right.
If it's killing so many of us. Obviously what you're saying to me is you can't prevent it either.
Right. That's right.
If it's there, it's there.
If it's there, it's there. Exactly.
So what's the next step in your research?
We'd like to we're continuing to enroll right now additional African Americans and African American families. Right now we would love to have people who are interested not only in being tested and into the clinical trials, but if you have a sibling or a relative or a parent who is diagnosed with Alzheimer's, which is the most common form of dementia, we'd love to get you in our study. So what we're going to have to continue to do, whether it would be a cancer or anything else we deal with, is continue testing. And we need more African Americans to come forward and to be involved. And so part of doing that, as you alluded to, is connecting to the community and building those bonds of trust to let them know that we have your best interest at heart.
Here's a question, and it may be another one of those crazy questions, is what's the first sign? What starts happening to me that you say, oh, she may be getting Alzheimer's?
Right. And I hate to even use this term because when I start to say some problems with memory or perception, everyone gets hyper alert. There are days that I even become hyper alert. If I look for my keys, I'm like, oh my goodness, what's going on?
And then that triggers everything else.
Then it triggers everything
Where's
else.
My pocketbook? Where's
right. But we would see a combination of things that might relate to behavior, memory loss, just forgetting really basic things. Like if you drive from your home to North Carolina A&T's campus once or twice a week and you get in your car and you're like, wow, I am not sure which way I go today. Or you get off an elevator and you have that moment and you're like, do I go left or right to the office? So it's been those pattern kinds of activities that you've been engaged in for a number of years, and all of a sudden you can't remember those types of things. And then other people around you will probably see some things, and they might deal with judgment, that your judgment's really off about something, that it's snowing outside and you shouldn't be driving and would never think of driving, and you're like, I'm going to go to the store to get ice cream or milk. And someone says, Mama would never do that. And so you couple that with a number of other factors, and then you might have a group of your children or loved ones come and say, we think you should see someone. And they start to give you a list of things.
And then they fight you.
That's right, that's right. And then you start to fight. Because remember, if there's going to be some memory loss and judgment, the person is not going to necessarily remember or make linkages that they're exercising or showing signs in this way, or that they're exercising the poor judgment. So we might see a group come together to say, these are 6 or 7 things that worry us, and we love you. So we want to take you to the doctor, to go with you, and let's ask about what may be occurring.
I've heard of Alzheimer's, dementia, sundowning. I mean, there's a list. So is Alzheimer's high on the list, or dementia? Where do you put it?
And dementia is the overarching umbrella for all these kind of progressive brain diseases that cause memory loss. And Alzheimer's is the most common form of dementia that we see. And sundowning is a symptom that we see people start to get progressively worse as it gets later and later in the afternoon. They may become disoriented, and we're not really sure about what goes on chemically. You know, we've got a number of things that start to occur near bedtime for older adults who might be medicated, including things like taking additional medications. With it getting dark, you know, there's a correlation when we look at sometimes depressive symptoms. And certainly we know that people become much more disoriented when they've slept, had a nap, they wake up. So again, we've got the overarching umbrella of dementia, Alzheimer's, and then the symptoms.
That happens.
That's
to
right.
you.
That's
I don't
right.
think
That's right.
we're not
And that's what
talking
makes
about
this
Alzheimer's.
complicated. That's right. That's what makes this really, really complicated. And you have to be really careful so that you don't frighten people. It's important that people have information so that knowledge is power, and that we get seen. One interesting statistic is that about 90% of people with cancer are told their diagnosis, but only about 45% of family members and individuals with Alzheimer's are ever given that diagnosis by a physician.
Wow. That's tough.
Right, it is.
And that doesn't help at all.
That's right.
What's the very next step for you in research here at A&T?
Continuing to look at gene sequencing, continuing to bring in families, to look at what you've just asked about earlier, that genetic predisposition, continuing to involve community participants and family members as far as support, education, awareness, advocacy, all those things that will help us.
Well, you can count on all of us here at A&T and the community to help you.
Well, thank you. This
very
was
much.
great. Oh, thank you for having me.
Dr. Sharon Cook, who is now in charge of COAACH. And we're not talking about athletics.
Not athletics.
We're talking about a department that's researching Alzheimer's. We're going to take a short break right now, and when we come back, we'll be talking more about what's happening in our whole Triad community with Alzheimer's.
This is the North Carolina A&T State University Historical Minute. I'm Marilyn Parker. The Dudley Memorial Building houses more stone applications than any other building on A&T's campus. A sweep of 15 stones guide visitors to the main entrance. Built in 1893, the original facility contained a library, an auditorium, and administrative offices. In 1930, a fire led to a reconstruction, and the facility was renamed after A&T's second president, James B. Dudley. Today, the building is home to the Maddie Reed African Heritage and H.C. Taylor Art Galleries, music classrooms, and laboratories. The Dudley Memorial Building is located on the east side of campus, directly behind the statue of the A&T 4 and right across from Dudley Road.
Welcome back to Triad Perspectives. It's produced by North Carolina Agricultural and Technical State University right here in our TV studio. We're proud to have this program to inform you about what's happening here on our campus and other things that are going on in our community, in our Triad community. My next guest today is Scott Herrick. He's the Director of Public Policy for the Alzheimer's Association of Greensboro. Is that the title correct?
Yes, for the state actually, for both chapters.
The whole
Western,
state.
yeah, the Western Carolina chapter and the Eastern.
Okay, so you're the man.
I don't know who might say that. But, yeah.
Sounds like you got your hands full,
I
that's
do.
for sure. Well, you just had your walk, the Walk to End Alzheimer's. How did that go?
We had a record turnout in Greensboro this year. I think we had over 1,600 registered walkers, so it was pretty impressive. And a lot of new teams were created, and I think the fundraising efforts were very, very good. So we're happy with the fundraising efforts. We do many walks throughout the Western Carolina chapter and the whole state. We do walks all over the place. And
So how do you raise money doing that?
well, we challenge people to do it through a grassroots effort. We say, to form a team and then try to get other people to join your team, and each of those people go out and try to fundraise individually, and as a group they come together. And the majority of the revenue that the Alzheimer's Association brings in, it actually does come through the walks.
So you just do it once a year?
We have a season. Yeah, we have a walk season, and that's what we're in now. Halloween would be the walk in Winston-Salem. So throughout basically early September to the mid-November is our walk season.
Now, when you go out to how do you get people? How do you get that many people to be in the walk?
It's tough. It's tough. I think a lot of it is word of mouth. A lot of it is through media impressions. We try to get TV to mention the walk. We get radio station personalities involved. The other thing that we do is we try to engage local businesses, whether they work in the senior industry or not. Most people at some point in time have been touched by Alzheimer's or dementia, so it's something that resonates with a lot of people in the community. So we go out and we'll do some corporate education on the disease itself, talk to them about employee resources, and then also mention the walks in our fundraising efforts and kind of break it down on how that is distributed when they do make donations.
So how's your fundraising effort going now? Do you have all the money you need to do the things you're doing, or could you use a little bit more?
We could always use more. It's one of those tough things where we could always be doing better on the fundraising side. Now, we're doing well, but we could be doing better. And that goes across the nation. This disease is an underfunded illness. It gets about $500 million in research money every year, which is good. It's an improvement from where it was. But still, when you consider it's the most expensive malady in the country, and it's more expensive than cancer, it's more expensive than heart disease, and costs are skyrocketing with this one, unlike any other disease, it's something that needs to be addressed.
So how can our viewers who are listening to you now help you instead of waiting till the next walk?
You're right.
What can they do?
There's a myriad of ways. That's a lot of ways that somebody can get involved with the Alzheimer's Association. Some people, it's not their thing to raise money. Some people want to become engaged with maybe educational content. Maybe they've been personally affected by this disease and they would like to share their story. I take those people with me to Raleigh to talk to our state legislators. I take them to Washington, D.C. every April, and we do a big Hill Day. We have people that go out and feel empowered to deliver educational content. They get training from us on how to do that. We send them out in the community. So there's a lot of ways to make a difference with the Alzheimer's Association. Fundraising is obviously something that is near and dear to us, and we appreciate anybody who wants to get involved in that endeavor, but like I said, there are lots of ways.
And all they have to do is call you.
All they have to do is call us. They can call the 800 number, say where they are, and they'll connect us locally, or they can call the local numbers and we can reach them directly.
Now, when you say you work in education, I always think education, I think little children.
Right.
So are you talking that young, or are you moving higher?
Actually, I am. Every once in a while, I'll get a call to go out and speak to a group of smaller children. And for example, I was engaged last month to go speak to Irwin Elementary School because they have a walk team.
Okay.
And she said, the person, I forget her name, but she said, can you come out and speak to our kids about Alzheimer's disease? I said, I'd be more than happy to, because they have grandparents that have this disease. They have aunts and uncles that are already showing signs of this disease. We don't want them to get it. So there are different things health-wise that we can try to implement in our lifestyle that might stack the deck in someone's favor, where all of us with a brain are at risk. So you can't eliminate risk, but you can manage risk.
I understand you can't cure Alzheimer's.
No.
But can you hold it off somehow?
Right now, no. Right now, the current medications that are available and that are FDA prescribed help with symptom management. The disease itself kind of runs unabated behind the scenes at the same rate as it would. The good news is I went to the international conference on research in Washington, D.C. a couple months ago, and there's some clinical trials now that have certain drugs out there that look like they're going to be able to slow down the effects of Alzheimer's disease. And so we're seeing some successes on the research side that over the next 10 years that we hadn't seen previously.
So when we talk to youngsters, let's say middle to high schoolers, and they're worried about something that's going on in their house, whether it's mom, dad, grandparents, or whatever. What's the one thing that they're seeing, or the one thing you can see immediately that gives you a clue that something's going on?
Well, if a high school student is noticing something, and it's actually with a parent, what they're looking at is probably a younger onset Alzheimer's, which walks and talks somewhat differently than what we would call our classic Alzheimer's. Tends to be more of an aggressive disease. It doesn't always manifest immediately with a memory problem. Sometimes it's behavior, sometimes it's mood. But I would encourage anybody who thinks, whether they're young or older, who thinks they're dealing with a loved one with this disease, first and foremost, get educated. Go to alz.org and start to get educated on the disease. There, the warning signs are posted. And we do programs on the warning signs of Alzheimer's. Sometimes it'll scare people because they'll say, I got like 3 or 4 of these, I might have it. But it's a good kind of a primer for what the disease looks like. And then if you still have concerns, I would reach out to the Alzheimer's Association and engage to a healthcare team. And I'm not just talking about the primary care physician. But you also want to engage things like your pharmacist. You want to engage anybody who might do diagnostics and try to discover if this really is what we're dealing with. Because sometimes it's not. Sometimes it's treatable.
And so what happens when the person who you're trying to help denies any kind of help?
That happens a lot. And it's a difficult thing when somebody is reluctant to get help for themselves. Often part of the process with this disease is loss of logical functioning. And so the person that you're saying, please try to go to the doctor, let's get an evaluation. Sometimes it's fear that's stopping them. Sometimes it's that they just don't see it. That's when one person alone cannot engage. You're going to have to need, especially if you're talking about a parent who's not used to having their children tell them what to do, you're going to have to engage other people that that person knows and respects. For example, if they're active in their church, and engage a deacon. Say, listen, there's some concerns we have. The other thing I would say is empower the person who you suspect has a problem with the disease to go get help so they can show you that they may not have an issue or that they're being proactive with their health management. So I think if you make it seem like it's not something you have to do, but something you can do for us, that type of thing tends to work better. But there are those cases where it's just tough to get somebody to the doctor.
Exactly right. But then the people all around that person, in a way, are kind of suffering too because they don't know what to do.
Right.
So is that something that you handle in your organization?
We do. And there are lots of cases where the person refuses to go to the doctor, but the family still needs education because in the home you're still going to have to deal with this issue. One of the things that I would really press your listeners to go do, though, is to get a diagnosis. And for the simple reason that sometimes it's not Alzheimer's. You could have different vitamin deficiencies in the body. You could have different infections that can cause a delirium, which walks and talks and looks like Alzheimer's. There are some things that are treatable that you can do. You could have a brain tumor that could be operable. Still preferable to Alzheimer's diagnosis, believe it or not. So that's why I would say if you think or suspect there's a problem, even within yourself, go in and get looked at. Because even if it is Alzheimer's, we know that early management of the disease, early medical intervention works better. You have a better health outcome, and also you have a better quality of life.
This is a crazy question, I know, but how long does a person have to live if they are diagnosed with full Alzheimer's?
The answer to that is complicated because in reality it's going to vary case by case. The disease is like Swiss cheese. Everybody's going to be somewhat different. But to give you kind of a baseline statistic, from diagnosis it's typically 6 to 8 years. One of the things that we know now that we didn't know 10, 15 years ago is by the time somebody is diagnosed, the disease has already been running in that person for 10 to 15 years. We call that state preclinical. It's preclinical because they're not showing any clinical symptoms yet. But the disease started much further back than people think. That's why when people think this is a disease people get in their 70s and 80s and 90s, that's a misnomer. It's typically something that you're more encountering in your 50s and 60s.
Oh my. You mentioned dementia. So does the Alzheimer's Association also work with dementia? Because those are two different things, right?
Well, dementia is just the umbrella term for the set of symptoms that we would associate. It's memory loss, it's the loss of the ability to think reasonably, logical functioning, and to navigate the world around you, find the CVS drugstore you've always found, and our mood and personality. When those things are compromised to the degree that we would say it's impacting someone's daily life, we call that set of symptoms dementia. Alzheimer's disease is the most common cause of dementia. It represents about 60 to 65% of it.
Okay. So now, for our viewers, if they'd like to get in touch with you for whatever reason, what's the best way to do it?
The best way is to call us on our 800 number, which is 800-272-3900, and talk to one of our counselors. We have social workers and different people who can help you on address any issues you may have at home or volunteer opportunities. The other thing is go to our website, alz.org, and in North Carolina, it's /North Carolina for anybody that lives west of Burlington, and if you live east, it's alz.org/NC.
Wow. Okay.
Yeah.
I have to look
So
all of that up to try
yeah.
to see. Here goes my memory now.
Yeah.
I remember all of that. But it's been great talking to you and getting advice from you, and hopefully you're encouraging lots of our viewers to get in touch with you or come help. Not just because they think they or someone they know has Alzheimer's, but because, you know, they could be helping you raise the money.
Right.
Or volunteering or doing some of those things that you're talking about, especially the little ones. I think about them all the time. You know, and they need to know if mom and dad are acting right.
And they tend to get left behind as far as the conversation goes. So
They do.
the fact that you're bringing that topic up is pretty timely, so
Great.
thank you.
Scott, thank you so much. Great having
Thank you for
with
having
us
me.
today.
Appreciate it very
That's
much.
all our time for now for today's Triad Perspectives, brought to you by North Carolina Agricultural and Technical State University. We'll be back next week with another show full of things about A&T and the community. I'm your host, Sandra Hughes. You have a great evening.